Hi everyone, I am Dr. Vyshnavi, your ENT faculty on the Unacademy platform, and today we are here to discuss rehabilitation of hearing. So in this class I shall be discussing about the various forms of implants that can be used, like a cochlear implant, like a bone anchored hearing aid, middle ear implants, and so on. Before we start the class, I'd like to take a quick confirmation from all of you if you're able to see me and listen to me. If you are, kindly give me a thumbs up. Good evening, Jakal Singh. I hope all of you are able to see me and listen to me. Good evening, Jakal Singh. I hope all of you are able to see me and listen. Okay, so let's begin our class. We are going to discuss about hearing rehabilitation. Good evening, Crazy Medico. So let me start with what we have on offering from Unacademy, which is iconic subscription, best from two of the best. So you can use Unacademy and Prep Ladder with Unacademy, where you will get all resources including plus subscription. You can use Unacademy and Prep Ladder with Prep Ladder, where you get all resources of 2021 Dream Pack. So you can either choose this package in Iconic, or you can use the Prep Ladder package in Iconic. To unlock the Unacademy 20% discount that we are running right now until 29th of June, you can use the code ENT live and you will get a 20% off. So please make use of the code until 29th of July and you'll get a 20% off on the plus subscription. We have a batch course called as Mission INI Set 2022, which is a high yield revision batch course starting from 27th of July with 360 hours duration, 4 hours a day. So you will have exclusive rapid revision, you will have INI set specific modules, 15-minute dedicated doubt solving sessions, recorded classes in case you missed the live classes, and INI set specific mock tests. We have very new feature coming on Unacademy which none of the platforms have for now, which is the live doubt clarification sessions. So we as educators are available for you to exclusively solve your doubts. In that particular session we have no discussion unless you have any specific thing to ask us. So we are exclusively there to ask you your doubts, the topics that you don't understand really well, the topics you couldn't follow through the classes, some difficult areas where you're finding it difficult to solve the questions. You can ask from any source, whether it is Unacademy, whether it is any other source, any other book, any format of question, any topic. You can feel free to ask us in this doubt clarification session. We will have both academic and non-academic doubts addressed. So if you've got non-academic doubts in terms of which branch is good, which hospital is good, how to go about, how to design a career path, all those also can be asked in this session. NEET PG 2023 test and discussion batch is there for repeaters, which is a 6 months batch course. So those who are already prepared and looking for MCQs to solve can join this batch course. We have 20% off on all subscriptions starting from July 17th to 29th. So let's begin. Can you identify what is this? If you identify this, can you please type it in the chat box? Although the name is mentioned, can you tell me and identify what is this? You can type in the chat box, what do you see this? This is a cochlear implant. So when do you use a cochlear implant? If there is a pathology in the cochlea, when you have got bilateral profound, severe to profound sensory neural hearing loss, where the cochlea is not functional, what do? You put an implant into the cochlea. So in the cochlea you will put an implant. Now the impulses will go directly to the 8th nerve. This sort of an implant is called as cochlear implant. It has got an external part and an internal part. So the external part receives the sound and processes the sound and then sends the sound to the internal part, which is the receiver. This will send the sound to the electrodes which are inserted into the scala tympani of the cochlea. So the electrodes go into the scala tympani of the cochlea, and from there the impulses are carried via the eighth nerve. So what are the indications to do a cochlear implant? When there is bilateral severe to profound sensory neural hearing loss more than 70 to 90 decibels, you will do a cochlear implant. What is the contraindication? If you have absence of cochlea, obviously can you do a cochlear implant? No. Or if there is a retrocochlear pathology, say there is an eighth nerve pathology or a pathology in cochlear nucleus, is there a point in putting an implant into the cochlea? Will it make any sense to put an implant into the cochlea now when the eighth nerve itself is not functioning? No. So you must not have a retrocochlear pathology, and there must be a presence of cochlea to do a cochlear implant. If there is absence of cochlea or if there is a retrocochlear pathology, you cannot do a cochlear implant. So essential criteria prior to doing an implant is the minimum age is as early as possible. Up even 1 year of age you can do an implant. Maximum age is up to 3 to 4 years, because beyond that the patient has not developed speech. So even if you put an implant, the probability of the child developing speech will be very, very less. The child must be given a trial of hearing aid prior to the implant, and if the child is not improving despite giving a very strong hearing aid, then you will go for cochlear implant. There should not be any evidence of absence of cochlea. So when you do a CT scan, you must be able to see all the 2.5 turns of cochlea and the eighth nerve and the central auditory pathway, which is your E. colyma, eighth nerve, cochlear nucleus, superior olivary complex, lateral lemniscus, inferior colliculus, and medial geniculate body and auditory cortex must be functional. If they are not functional, obviously it makes no sense to do an implant. So now let's go to the second part. So you've understood the image of cochlear implant. Now let us see what is this implant. The indication for this implant is bilateral profound sensory neural loss, bilateral mixed hearing loss, external auditory canal atresia, none of the above. So can you type it in the chat box? What do you think is the answer? Yes, I am waiting for your answers. So Tanvi says A. What about others? Okay, I'll give you an idea. At least look at this and tell me. What does BAHA stand for? It is a BAHA. BAHA is for bone anchored hearing aid. So when will you use a BAHA? What is the indication of using a BAHA? Since it is anchored to the bone, where will the sound go? Whenever there is a bone conduction, will the sound go directly to the cochlea? Yes. So here we have got an implant that is kept into the squamous temporal bone, over which you will place a receiver. This will receive the sounds and send the sounds directly to the cochlea, either the ipsilateral cochlea, it can also send to the contralateral cochlea, it can send to both. So if there is an external auditory canal atresia, if the pinna is not developed, can we do this implant? Yes, because it bypasses the external ear and middle ear, and since it sends the sound directly to the cochlea, you can do this. Now if there is a unilateral sensory neural hearing loss, so if assume that this cochlea is not functional, say this cochlea is not functional, can it send the sounds coming from the deceased side to the opposite cochlea, and from there can it be conducted to the brain? Yes. So can it be used in unilateral sensory neural hearing loss? Yes. So BAHA is basically involved whenever there is a unilateral severe to profound sensory neural hearing loss. Okay, in bilateral severe to profound sensory neural hearing loss, you will use a cochlear implant. If it is unilateral, single-sided severe to profound sensory neural hearing loss, you will use a BAHA. If there is an external ear or a middle ear deformity, again you will use a BAHA. So BAHA is used whenever there is a external ear deformity, middle ear deformity, chronically discharging ear, and a single deaf ear who have no benefit from hearing aid. So here if we go back to the question, this is a BAHA. So is it used in bilateral profound hearing loss? No, unilateral. Bilateral mixed hearing loss? No, unilateral. External canal atresia? Yes. So that's the indication of BAHA whenever there is an external and middle ear disease. And if there is a patient who is not having bilateral disease but unilateral sensory neural hearing loss which is severe to profound, then you will use a BAHA. Got it everybody, the indications of BAHA? If you have got it, just mention yes in the chat box. That way I would know whether you are following the class or not. Got it everybody? Yes. So if I give you a question, bilateral severe to profound SN loss, what will your answer be? Which type of hearing rehabilitation will you do? Cochlear implant, BAHA, middle ear implant, or a hearing aid? What will your answer be? It is bilateral. You will do a cochlear implant. If there is unilateral severe to profound hearing loss, sensory neural hearing loss, then what will you use? I am waiting for your answers. There is a lag, but still I will wait for your answers. Unilateral severe to profound sensory neural hearing loss, what will you use? Yes, BAHA. If there is a patient who is having any external ear or middle ear deformities, then what will you use? BAHA. If there is a patient who is having moderate or moderately severe hearing loss, what can we give? We will give them hearing aid. So based upon the hearing loss, now you got an idea of what is used in what situation? Yes. So in a BAHA, you get a screw, you get an abutment and an implant. This implant is integrated to the squamous temporal bone. Once it is integrated with the squamous temporal bone, over that you will place the abutment screw and then place the sound processor. And once the sound processor is placed, it will receive the sound and transmit via the bones to the cochlea. Now can you identify what is this implant? Identify this implant. See, this is a sound processor on the outside. There is a decoding chip or a receiver inside. You will see this electrode bypassing even the cochlea, bypassing the 8th nerve, and it is going into the brain stem. So what is this implant? This implant is called as auditory brainstem implant. ABI stands for auditory brainstem implant. Now if there is a retrocochlear pathology, say if the 8th nerve is not functioning, can I do a cochlear implant? We cannot, because there is no use. 8th nerve is not functioning, there is no use. So should I now bypass the 8th nerve and then place the implant? Yes. So auditory brainstem implant is placed in the recess of the 4th ventricle. So in the recess of the 4th ventricle, you will place this auditory brainstem implant. Okay. In the floor of the 4th ventricle, in the recess of the 4th ventricle. So the indication is whenever the 8th nerve is not functional, then you are going to use this auditory brainstem implant. Okay. So it is used whenever there is a 8th nerve lesion. It stimulates the cochlear nucleus directly, and it is placed in the lateral recess of the 4th ventricle. So it is used in bilateral acoustic neuroma, cochlear aplasia, cochlear nerve aplasia. So whenever there is cochlear or cochlear nerve pathology, then we are going to use a auditory brainstem implant. Now answer this question. In a case of bilateral profound hearing loss, the best method to rehabilitate is hearing aid, cochlear implant, stapedectomy, brainstem implant. Very easy question. We have already discussed this. I am waiting for your answers in the chat box. Okay, so Crazy Medico says B. Avinandan Mishra also says B. What about others? So we've already learned bilateral severe to profound hearing loss. What you will use is a cochlear implant. Hearing aid is used whenever there is a moderate or moderately severe hearing loss. Sensory neural hearing loss or conductive hearing loss. Stapedectomy is used whenever there is a patient suffering from otosclerosis, and brainstem implant is involved whenever there is a cochlear nerve pathology. Then you are going to use a brainstem implant. A 3-year-old child has been diagnosed as bilateral moderate sensory neural hearing loss. The best way rehabilitation. Now we've already discussed this, so please answer very quickly. See, moderate sensory neural hearing loss. Dhananjay, can you tell me what is the answer? Avinandan Mishra says B. What about others? See, it is not profound, it is moderate. See the previous question, it was profound. Here the question is moderate hearing loss. So for a moderate hearing loss, what will you use? Harshit, Supratim, Avinandan Mishra, what would you use? The best way to rehabilitate will be a hearing aid. Why should you do a surgery when there is no need? Yes. So in this situation, you will use a hearing aid. So that's the answer. Now a cochlear implant converts which energy to which energy? Sound energy to mechanical energy, electrical energy to mechanical energy, sound energy to electrical impulses, mechanical energy to kinetic energy. Yes, I am happy that Avinandan, Harshit, you have corrected your mistakes. Dhananjay, the answer is hearing aid because it's a moderate hearing loss, not a profound hearing loss. Very good, Smith. Yes, so a cochlear implant converts, it takes the sound from the environment and converts them into electrical energy. Once it is converted into electrical energy, the electrodes will now carry the electrical energy and transmit it to the cochlea. Okay, so the sound energy is converted to electrical impulses by a cochlear implant. All of you are right. Nandkumar, Avinandan, Harshit, Tanvi, Shivam, very correct. Ideal time to treat hearing loss is 6 months, 1 year, 2 years or 3 years. What did I tell? In hearing loss, what should you do? When should you treat? Because if there is hearing loss, speech development also will be affected. So when should you treat that patients with hearing loss? Yes, Tanvi, you are also answering right. I am sorry if I missed that. Yes, so the ideal time is as early as possible. So even 6 months, if that's the least in your option, you can choose. If they would have given 3 months, you can choose 3 months, because if you treat it late, speech will be affected. So as early as possible. So 6 months is your answer. Okay, then we got it. BAHA is used in which clinical scenario? Bilateral profound hearing loss, bilateral serous otitis media, bilateral microtia and canal atresia, post-operative rehabilitation for a patient with acoustic neuroma. I have told you BAHA indication. I'm waiting for all your answers. Smith, Tanya, Supratim, very good. You're right. I'm waiting for answers to come from others as well. Then I will discuss this. Very good, Kiranjit, Harshit. Yes, Nishita, very good. So, Baha is used whenever there is an external ear or middle ear deformities. It is also used whenever there is a unilateral severe to profound sensory neural hearing loss. Not mild to moderate, but severe to profound sensory neural hearing loss. Then also we can use. So bilateral profound is not Baha, it is cochlear implant. For serous otitis media, we will put a Grome. Rehabilitation for acoustic neuroma is an auditory brainstem implant. But if there is microtia and a canal atresia, we can use a Baha because it bypasses the external ear and middle ear and the sound goes directly to the cochlea. In a patient with otosclerosis, the rehabilitation for hearing is initially done with hearing aid, sodium fluoride, stepidectomy. So Saurabh, you're asking me, you want to note down the questions. So Saurabh, basically when you're preparing for your examinations, it's important to prepare two things. First, concepts. The second is practice of MCQs. Now MCQs, you can practice it from various platforms on Unacademy. We have got an Unacademy Lite app where you can have questions, previous year's questions, subject wise questions, topic wise questions. And I said NEET PG, FMG specific questions. So that app is exclusively for MCQs. So you can use such apps to practice. But you have to go through your theory textbooks, you have to go through formal classes to get your concepts right. Then only you will be able to, solve the questions in your examination. So here we are doing only a practice session on specific small topics in these small classes. Okay, so if you want these classes, you can take these questions when we are discussing, write down them in your notebook and practice them. Okay. So class questions is when we are taking classes like this, you will have to write down these questions in your notebook because there is no other way that we can go about it. Okay, so here in patients with otosclerosis, there is what type of hearing loss? Conductive hearing loss. So if there is a conductive hearing loss, can we not treat it by amplifying sound and just giving hearing aid? Yes, so it is treated initially with hearing aid. Now if the patient refuses hearing aid and he says I don't want a hearing aid, then you can go for surgery. If the patient is having active otosclerotic focus, then you can give sodium fluoride, which will prevent further progression, but it cannot reverse back the disease. And if the patient was surgery, then you can do stepidotomy or stepidectomy with placement of prosthesis. But initial rehabilitation is done with hearing aid. Okay Saurabh, I hope you got the answer for your questions. If there's more, you can always write and I'll try my best to help you in whatever situation it is. Okay. Cochlear implant, CI is for cochlear implant, is contraindicated in which of the following? Shebe's dysplasia, Mondini's dysplasia, Alexander's dysplasia, Michael's aplasia. Very good, Sauvik, Smith. I'm waiting for all to answer. Yes. So what is Shebe's dysplasia? If the the saccule and the cochlea are dysplastic, not developed properly, then we call it as Shebe's dysplasia. In the name only you have S is for saccule, C is for cochlea. So saccule and cochlea are dysplastic. Mondini's dysplasia is normally cochlea takes 2.5 turns. But if it takes lesser than 2.5 turns, like 1.5 turns, then you call it as Mondini's dysplasia. Alexander's dysplasia. Alexander, after A comes the alphabet B. So if the basal turn is not developed completely, then we call it as Alexander's dysplasia. So these are dysplastic conditions. So can I use electrodes which are short, which are smaller in size, and yet do a cochlear implant? Yes. But aplasia, once there is complete non-development of cochlea, where will I put my electrode? I cannot. So is this a contraindication? Yes. So did you get that? Michael's aplasia is the answer. Electrode of cochlear implant stimulates your outer hair cells, inner hair cells, basilar membrane, or the auditory nerve. Even this I have told it to you during the class. Very good, Tanvi Guru, Bindu Kumari. Tanya, please recheck Smith, please recheck. I have told you we'll put the implant in the scala tympani, but the impulses are going to what? Is it going through the, is it going to the 8th nerve directly? Yes, so it is going to the auditory nerve. In cochlear implants, electrodes are placed through, they are not asking where it is kept into, they are placed through what? Scala vestibuli, scala tympani, oval window, round window. So in cochlear implant, electrodes are placed through what? So we are keeping the electrodes into which compartment of the cochlea? We are putting it in the scala tympani. Scala tympani on one end is covered with which window? Round window. So if the electrode has to go into the scala tympani, does it have to go through the round window? Yes. So electrodes are placed through the round window. If the question is electrodes are placed into which compartment, then your answer would have been scala tympani. Okay. So the answer is round window. Now can you identify this? What is this implant here? See, there is something in the middle ear that is working in coordination with an implant kept externally. So there is a piezoelectrical communication through which the implant is working. This is called as middle ear implant. So the implant that you see here is called as middle ear implant. So whenever the sound comes, the piezoelectric mechanism makes the movement of this implant, and this causes movement of the ossicles and sends the impulses into the cochlea. Okay. So middle ear implants is suitable for those patients who are having mild, moderate, mixed or conductive hearing loss or sensory neural hearing loss. But it should be how much? Mild to moderate. It cannot work for moderate or moderately severe. It is a more recent type of hearing implant offering an alternative to conventional hearing aid. So those who do not want something on the outside, they wanted something inside, then you can use. It may be considered for those patients who have allergy, because we keep a hearing aid on the outside, they can have allergy to that. They have outer ear infections, narrow or collapsed canals. In that situations, you can go for middle ear implant. So with this, I finish the class for discussion of implant otology. I hope you understood the indications for cochlear implants, middle ear implants, bone anchored hearing aids, and normal hearing aids. For otosclerosis, how do we rehabilitate it? If there is any question, you can feel free to ask me right now. I am here to answer your questions. Avinandan Mishra, you're welcome. Is there any doubt that you all want to ask me, or can I say bye-bye for now? I'll wait for a minute or two to see if you've got any questions. So So if you've got any doubts, please feel free to ask. So on Unacademy, we have an exclusive doubt clarification session. So for ENT on 1st of August, we have this session, 1 hour session from 10 to 11 p.m. I'll be solving only doubts on that day. Okay, so Avinandan, stapedectomy versus stepidotomy. Now stapedectomy is, now this is your malleus, this is your incus. I have removed the complete stapes and I just put an implant going from the incus to the oval window. There is no part of stapes that is left behind. This surgery is called as stapedectomy. Okay, stepidotomy, this is your malleus, this is incus. I may keep the suprastructure, I may leave the suprastructure, I may have the foot plate intact covering the oval window. So I'll make a hole and now through the hole I'm inserting the electrode. In some situations I can have the suprastructure, some situations I may remove the suprastructure, but the foot plate is intact and you just make a hole in the foot plate. This surgery is called as stepidotomy with placement of prosthesis. Got it? Yes. So Harshit, you want quick revision of questions. So this is the last question, which is a middle ear implant. Then I had asked you in cochlear implant, electrodes are placed through round window. Electrode in cochlear implant stimulates the auditory nerve. Cochlear implant is contraindicated in cochlear nerve or cochlear aplasia. Otosclerosis rehabilitation is done initially with a hearing aid. BAHA is used whenever there is an external ear or middle ear deformity or unilateral severe to profound sensory neural hearing loss. Ideal time for treating hearing loss is as early as possible. Even at 3 months, 6 months of age, you can rehabilitate by using hearing aids. Cochlear implant converts mechanical energy, sound energy to electrical energy. If there is a child with bilateral moderate sensory neural hearing loss, you'll use hearing aid, but the same child with profound hearing loss, you'll use a cochlear implant. Before this, I just gave you an insight of cochlear implant, BAHA and their indications. Okay, so is it enough to read only high yield topics? Tanvi, I see, nobody can guarantee you 100% surety that it will come from high yield topics or not. But having said so, the high yield topics basically focus on the recent examination patterns and what topics have come in the recent exams. So yes, those are some things which you cannot tend to miss at all. But having said that, there is no 100% assurance that you will get only from the high yield topics. You can place a special emphasis on the high yield topics, give them more time to study. But yes, at least rest of the topics you must have a little bit idea of the concepts, at least, if not the complete in-depth idea, but at least concepts you should know. Okay. So anything else that anyone wants, anything else that you have a doubt for, please ask. Okay, so I think there's nothing. So I'll take your leave and I'll see you all again. Okay, take care and bye bye.